You're watching Pam Salisbury, David Crabtree, Greg Fishel, and Tom Suter on WRAL's 5 o'clock First News.
Breast cancer. We hear about it all the time in women, but almost never in men.
However, men do get breast cancer. Dr. Alan Mass joins us now to take a closer look at male breast cancer in tonight's Health Team Report.
Pam and Dave, for every 200 cases of breast cancer in women, there's one case of male breast cancer. Although it's rare, male breast cancer is just as devastating for a man as a woman.
This right here is our pride.
Frank Scara's dog Ruby gives he and his wife Debbie a lot of pleasure, and they need a little happiness. Frank was diagnosed in May with breast cancer. A few weeks before, he noticed some changes in his right breast.
And I looked at my right nipple, and it looked like spider webs of purple, reddish, threads. Discoloration.
Frank went to a doctor and tried using salves and creams on his breast, but it didn't help. A mammogram pinpointed his problem, male breast cancer. So he had his right breast and lymph nodes removed.
My reaction? I don't know. Sledgehammer, back of the head, sudden loss of air, palpitations. Meet your maker, I'm not ready to go, on and on, all of that.
Well, when it all first happened, it was very, very hard to adjust the strain, the stress, trying to grasp it, because you don't think it could happen. And I never heard of male breast cancer, so it's like I didn't want to believe that he had it.
In his case, there was some already to other organs in his body, which made his prognosis not as good as somebody who did not things at diagnosis.
After Frank's mastectomy, Dr. Berry didn't treat his cancer with radiation or chemotherapy. Instead, he's on hormone therapy. So far, Frank's responding to it well. Frank and Dr. Berry say even though male breast cancer isn't common, men shouldn't think it can't happen to them.
It is rare. It's not something men should panic about, but it is something that they should be aware of. And if a man does get a lump in the breast, particularly if it's just on one side, it should not be ignored.
Guys got to start going to the doctor and saying, look, I heard on TV there was a guy that was 56 years old, has breast cancer. I want to be checked for it.
Dr. Berry says Frank Scara is in remission, but there are still signs of cancer on his x-rays.
Now, Dr. Matz, we've heard for years encouraging women to get monthly breast exams or to check themselves monthly. Is that something that men should do as well?
Well, men should be aware of their bodies. So yes, from time to time, we should check our breasts for lumps or changes. And don't stop there. Men should also check their testicles and get their prostate checked as well. There are nodules that can be found in young boys at puberty at age 12 or 13. This is not breast cancer. This is a disease that happens much later in life.
And I guess as in all cancers, early detection is key.
Absolutely, Pam.
Amazing story. Alan, thank you.